Welcome to Dr. Balaga's God Knowledge Doc podcast, your quick dive into the latest medical breakthroughs to keep you ahead of the curve. Let's get started. Today is October 27, 2025. This video is on a recent New England Journal of Medicine article titled Aspirin in Patients with Chronic Coronary Syndrome Receiving Oral Anticoagulation. This video is on the AQUATIC Trial. Patients with chronic coronary syndrome receiving long-term oral anticoagulation remain at unclear risk regarding dual antithrombotic therapy. The existing evidence was limited by open-label designs and low-risk populations. Aspirin is often added despite bleeding risks. So this was a prospective double-blind, randomized, placebo-controlled trial in 51 French centers, 872 patients with prior stent implantation about more than 6 months ago, with high atherothrombotic risk on oral anticoagulation, comprised the study cohort. The median follow-up was 2.2 years. They used the adjusted Cox frailty model, power set at 80% for detecting hazard ratio of 0.75, with an intention to treat analysis. Key takeaways: higher event rate with aspirin versus placebo, 60.9% versus 12.1%, hazard ratio 1.53, p-value 0.02. Mortality, death from any cause, 13.4% in double digits with aspirin and 8.4% with placebo, p-value 0.01, hazard ratio 1.72. Bleeding risk, major bleeding risk with aspirin, 10.2%. versus 3.4% of major bleeding with placebo, hazard ratio 3.35, p-value 0.001. Limitations of study: early trial termination, limited generalizability beyond high-risk chronic coronary syndrome population. In conclusion, patients with chronic coronary syndrome on anticoagulation, adding aspirin increases ischemic events, mortality, and bleeding. Clinical pearls: aspirin plus oral anticoagulation is not beneficial in chronic coronary syndrome with prior PCI at high thrombotic risk. Mortality signal emerged early, supports reassessment of routine dual pathway strategy. The trial reinforces the evolving trends towards minimizing dual therapy in stabilized coronary artery disease. Kaplan-Meier curve showed early and persistent divergence in bleeding outcomes. Future research should address personalized de-escalation strategies in high-risk groups. Eponyms, please read this slide at your leisure. Hit pause. An important one is the Rubin's rule. This is applied for imputation in missing data analysis. In essence, after analyzing each imputed data set separately, the Rubin's rule provides a way to aggregate the estimates, example hazard ratios, regression of coefficients, and compute a pool variance that reflects both within imputation and between imputation uncertainty, a common technique to handle missing data. If you enjoyed this episode, share it with your colleagues. When we change how we see disease, we change how we shape lives. Until next time, stay curious, stay compassionate, and keep seeking wisdom. Podcast brought to you by masterbedfacts.com. This podcast is for physicians and healthcare providers. If you enjoyed this video, please like, subscribe, and forward to your friends.